Welcome to this episode where we're diving into a crucial cognitive skill for nursing clinical judgment, analyzing cues, especially as it relates to the HESI Next Generation NCLEX exam. This skill goes way beyond just spotting data. It's about interpreting what those data mean in the context of the whole clinical picture.
Yeah, absolutely. It's one of those foundational skills that really underpins safe and effective clinical decision-making. And it's heavily tested not only on the NGN, but also in nursing courses. So understanding how to analyze cues is essential for anyone preparing for these exams or working in clinical practice.
Right. So let's start by clarifying what we mean by cues. These are the relevant clinical data points: signs, symptoms, lab values, vital signs, patient history, that give us insight into the client's condition. But the key is not just identifying these cues, but linking them to the client's specific clinical context.
Exactly. It's a dynamic process. You have to sift through all the information, decide what's relevant, and then interpret what those linked data mean about the client's current health status. It's not rote memorization. It's critical thinking in action.
I like to think of it as connecting puzzle pieces. Each cue is a piece, but only when you connect it to others and the bigger clinical context does the full picture emerge. Some cues support a diagnosis, others might contradict it, and weighing both is crucial.
That's a great analogy. And it really highlights why you can't just look at isolated findings. You have to consider the bigger clinical picture. For example, a single elevated lab value might not mean much until you see it alongside symptoms or other data.
Speaking of examples, the document gives us a few really illustrative ones. Let's start with the infant with the white coating on the tongue. The parent reports it's been there for 2 weeks and can't be wiped off with a washcloth.
Right, so the cues here are the white coating's duration and the fact it's not removable. That's important because a white coating on an infant's tongue could be just milk residue, which is benign, or it could be thrush, a fungal infection.
And the inability to remove the coating is a key cue pointing toward thrush. So analyzing these cues leads to a concern for thrush rather than just benign residue, which has direct clinical implications, like the need for antifungal treatment.
Exactly. Duration and response to cleaning are subtle but critical cues that help differentiate between a benign finding and a pathological one.
Then there's the newborn with a heart murmur detected after a home birth. The murmur could be innocent or could indicate a congenital cardiac condition.
The cue here is the referral for cardiology consultation, which signals suspicion of pathology. So the nurse analyzing these cues understands that further evaluation is needed rather than jumping to conclusions.
It's a reminder that some cues require additional diagnostic workup, not immediate diagnosis. That's part of the nuance in analyzing cues.
Now, the most complex example, and probably the richest for discussion, is the 65-year-old adult with diarrhea. This one really shows how multiple data points come together.
Yeah, the client reports 5 to 6 episodes of diarrhea daily for a week, mixed watery and formed stools, no blood, no abdominal pain. Vital signs show a heart rate of 110, blood pressure 102 over 68, and normal temperature.
And the labs are telling. White blood cells are elevated at 15,000, with segmented neutrophils at 75% and band neutrophils at 10%. That's a classic shift to the left, indicating an acute bacterial infection.
Right. The shift to the left means there's an increase in immature neutrophils, bands in the blood, which is a hallmark of bacterial infection. It's often overlooked, but is a key hematologic marker.
Then there's the elevated blood urea nitrogen at 24 with a normal creatinine. That's subtle but important. It suggests dehydration rather than intrinsic kidney damage.
Exactly. And the vital signs support that too. Tachycardia and borderline low blood pressure are consistent with volume depletion from diarrhea.
The stool culture confirms Clostridium difficile toxin, which clinches the diagnosis of infectious colitis.
So, analyzing these cues together, the history, vitals, labs, allows the nurse to anticipate complications like dehydration, prioritize interventions like fluid resuscitation, and plan for infection control and targeted antibiotic therapy.
And don't forget electrolyte monitoring. Even though potassium and sodium are normal now, ongoing diarrhea can cause imbalances. So vigilance is key.
This example really shows the integrative nature of analyzing cues. It's not just about spotting abnormalities, but linking them to pathophysiology and clinical context.
Absolutely. And it highlights the importance of considering both supporting and opposing cues to avoid premature closure or misdiagnosis.
So when approaching NGN questions that test analyzing cues, the strategy is to first identify unexpected or abnormal findings.
Then link those findings to possible client conditions, thinking about the underlying pathophysiology and clinical context.
Next, ask yourself, what do these findings mean? What is happening to the client? Are there cues that support or contradict a diagnosis?
And finally, consider if additional information would help clarify the clinical picture. NGN questions really test this integrative thinking, not just recall.
Right, it's about practicing this skill by reviewing clinical scenarios and lab data, always asking why and what next.
To wrap up, mastering analyzed cues is foundational for safe, effective nursing care and clinical judgment. It helps nurses anticipate complications, prioritize interventions, and collaborate effectively with the healthcare team.
And on the NGN exam, this skill is heavily tested because it reflects real-world clinical reasoning.
So listeners, think of clinical data as interconnected signals, not isolated facts. This skill grows with experience and deliberate practice. Review cases, reflect on your reasoning, and integrate new knowledge.
Well said. That's a solid foundation for anyone preparing for the NGN or working in clinical practice.
Definitely. Thanks for joining us in this deep dive into analyzing cues.
Thanks. Until next time.